Over 100 countries have now reported confirmed COVID-19 cases. As of Sunday morning, the Texas Department of Health and Human Services is reporting 8 in Texas. There are no confirmed cases in Travis County, but as the CDC says, it's not if the novel coronavirus will spread, but when. Dr. John Bedoya is joining us with UT Medical School. Thank you so much for joining us in studio. I want to talk about some of the concerns surrounding the coronavirus. There's not much that we know. What is this virus and how can it be contracted?
Well, it's a highly contagious RNA virus. Every person who gets sick can pass it on to 4 more people. Fortunately, it has a fairly low mortality rate. It's only about 1 in 1% as opposed to previous reports that showed it to be much higher. So there are very few deaths in countries that have good medical support.
And as you know, South by Southwest was just canceled. That's a huge impact on the city of Austin. Should we consider canceling other events, and what do you make of that decision?
Well, I think it should be taken on a case-by-case basis. Right now, the CDC is not recommending that events, mass gatherings be canceled. And so local jurisdictions, and Austin is ahead of the curve on this because they have a commission or a council of experts in this area that is giving recommendations to the city of Austin regarding whether they should cancel events or not.
What are some of the misconceptions you're hearing and seeing right now?
Okay, so that's spread mostly by droplet contact, and that is by coughing in close proximity to someone or sneezing in close proximity, or sneezing or coughing on your hand and then shaking someone's hand, and then they touch their face and then transmit it that way. It is difficult to catch from someone who's not having symptoms. Early on, there were case reports that people could pass it without symptoms. It turns out that's really very rare. So if you're in a public place and someone's not sneezing or coughing, it's very unlikely that you're being exposed to this. So there is a fear around the way this is transmitted, and there's a fear that people who have no symptoms can transmit it. There's also a fear that it has a mortality rate, a high mortality rate for everybody. Most of us who are healthy and under 50 have not much to worry about.
And, you know, as health officials mentioned, as you mentioned, those most at risk are people over the age of 65 and people who have a compromised immune system. What can people do to protect themselves?
So if you are over 65 or you have a lot of medical problems, then avoid any non-essential travel and avoid shaking hands. And if you are in a situation where someone is coughing or sneezing, then get out of that situation. And I would say that basically I would stay at home and ask your loved ones to help you, but if they're sick, to not come by.
Thank you so much for joining us. We greatly appreciate it.